In this video, let us discuss about fetal skull or neonatal skull. So if you see the skull of a fetus, it is somewhat small when compared with of adults. The fetus skull is in a ratio of 1:7, whereas if you see the adult skull, it will be in a ratio of 1:2. So fetal skull is small mainly due to the rudimentary mandible. You can see here it's like undeveloped, and even the maxilla is also undeveloped, right? Because of there is no eruption of teeth either, if you see in the maxilla or also in the mandible. Okay, and there is a small size of maxillary sinus. Maxillary sinus will be here, so there is a small size of maxillary sinus, and also the nasal cavity is still underdeveloped. So as many structures are still underdeveloped, the skull of fetus looks somewhat smaller. And next, coming to the base of the skull. So if you see the base of the fetus, so you can see here the base of the fetal skull. So the base is short and narrow, though internal ear is like almost of adult size, but the teres temporal bone is not reaching the adult end. If you see from the base, you can see the teres temporal bone, right? So you can't see the teres temporal bone properly in the case of base of skull in fetus. Now coming to the structure of bones, if you see these bones, these are unilamellar, means still they are very thin bones. Lamellas pile up on each other and form the adult thick bone, but here the bone is somewhat smooth, unilamellar, and there is also no dipole formation here. The tables and dipoles appear by 4th year of age. So let me show what is dipole. So you can see here, dipole is nothing but like it's a space, spongy cancellous bone space between the outer and inner layers of the skull. So it is still not formed in the case of early fetal skull, but later when the skull of it is turning towards adult, then this dipole will start forming. So now if you see the frontal and parietal tuber, actually here will be the frontal tuber, here will be the parietal tuber. So the frontal and parietal tuber both are prominent in fetal skull, whereas glabella, glabella will be here, glabella and superciliary arches, and mastoid process, mastoid process will be here. So these are still undeveloped. Okay, now coming to paranasal air sinuses, even they are undeveloped, absent. Now coming to the temporal bone, you can see here clearly temporal bone. Here in the temporal bone, the internal ear, tympanic cavity, tympanic antrum and ear ossicles all are of adult size, but the tympanic part is represented by incomplete tympanic ring. You can see here the ring-like structure, not here exactly. Let me show it in another diagram. So you can see here the ring-like structure. So the ear is actually in the form of tympanic ring, and the mastoid process is absent and it appears during later part of 2nd year. External acoustic matrix is short, straight, and its bony part is still unossified, and it is represented by a fibrocartilaginous plate here. Tympanic membrane faces downwards laterally due to absence of mastoid process. Stylomastoid foramen, actually it is not seen here, but here it will be present. Stylomastoid foramen, it is exposed on lateral surface of skull because mastoid portion is still flat. Okay, now coming to the orbit, if you see the orbit, it is large and the germs of developing teeth lie close to the orbit floor. Actually you can see the nasal cavity floor and even this orbit floor, they are like almost in the same plane, right? But if you see in adult, they are like different. Now coming to postnatal growth of skull. So how the skull is going to grow? There is growth of calvaria and facial skeleton at different rates over different periods. So growth of calvaria is related to growth of brain, whereas facial skeleton is related to development of different facial muscles, like muscles of mastication, tongue. Rate of growth of base, vault are also different. So actually they all grow in a different way. The calvaria will grow in a different way, the facial skeleton will grow in a different way, and even the base of the skull will grow in a different way according to the accommodation of different organs, like different parts of the skull. Now let us see the closure of fontanelles. So actually what are fontanelles? This is the anterior fontanelle where the frontal bone joins with parietal bone, and this is the posterior fontanelle where parietal bone joins with occipital bone. Okay, so actually these fontanelles are close, especially if you see the anterior fontanelle, It closes by 18 months. This anterior fontanelle is also called bregma. Okay, next we have mastoid fontanelle. Actually, that will be somewhat lower, you can't see it in this diagram, and that mastoid fontanelle closes by 12 months, whereas the posterior fontanelle or lambda, it is closing by 2 to 3 months. And there is also sphenoid fontanelle, between sphenoid bone, which closes by 2 to 3 months. Okay, so what is the clinical anatomy related to it? Fontanelles help to determine the age in 1 to 2 years of the child. Okay, so they also help to know the intracranial pressure. So in the case of increased intracranial pressure, bulging is seen, okay, at the anterior fontanelle. But if there is low intracranial pressure, then you will see dehydration in the anterior fontanelle. So till 1 to 2 years of the child, you can easily see the intracranial pressure at the anterior fontanelle site. Now let us see what are called as Vermilion or sutural bones. So in this diagram you can clearly see this is the Vermilion bone. So actually the Vermilion bone is a small irregular bone, especially found in the region of fontanelles, and they are formed by additional ossification centers. So they are most common at the lambda. You can see clearly this is the lambda side. At asterion, asterion will be in the front side, right? In the back side, and also can be seen at pterion and at bregma rarely. So Vermilion bones are commonly seen in hydrocephalic skulls, mainly in hydrocephalic skulls. So by this we completed the fetal skull. In the next video we'll start the craniometry.